Hi, Ann Maclam. I'm trying to get my thoughts together and make my statements regarding my surgery and what the doctors told me. It's pretty interesting. It's been an interesting journey. Um, I decided that I would make my remarks in my dining room. So that's where I am today. I'm not downstairs in the dining room thinking about things. Um, On Tuesday, it will have been 1 whole month since I had the surgery. I had the double mastectomy with the beginnings of a reconstruction. Um, what can I say? I've been a little bit tired. I haven't been doing much. I have been out of the house a little tiny bit. Um, Decision making at this point, not great at making decisions. But that's okay. It will all come back to me. Um, let's see. I saw my breast cancer surgeon and my plastic surgeon while I was in the hospital. And I think they visited me twice. And they told me what their findings were and how the surgery went. And I was given a 2-day pain blocker and some other medicine because I chose to spend the night in the hospital, which was a good thing. But anyway, I think because of all of that, plus the 7-hour surgery, um, I cannot remember a single thing that they told me about the surgery. So that's okay. The important thing was that I made it through the surgery, and my sister was here to take care of me for 3 weeks, which was great because I don't think I could have did anything on my own. I am a piano teacher, and luckily for me, my sister knows piano, and she taught some of my students for me. And we also taught together on some of them, and I taught some. Actually, when I came home on Wednesday, the day after surgery, I had some student that I forgot to cancel. So I actually taught that student on Wednesday night. And then I think I taught some people on Thursday, and I think I taught somebody every day except for one day when my sister and I ate something that made us both sick. So I spent the whole day in bed when that happened. Uh, but she was still up and taught. But the the bottom line is, clinically, my breast surgeon thought that I had stage 2A cancer on my left side and a stage 0 on my right side. And she thought that the site on my right side was in two places. And sorry, this is what she calls clinical. That means they don't have all of the information, they just had based on the information they had. Um, and she thought also that on my left side, that the large sentinel node that had come back benign, she thought that would be cancer. And on my right side, I don't think she thought that one would be cancer. Um, but anyway, she decided to take one node out of my right side, and it was benign. And then she took 3 nodes from the left side, and this was because all of them dyed blue when they put the radioactive fluid into me. So 3 came up blue on the left side, and 1 came up blue on the right. But however, only 2 of the nodes on the left side had cancer. Um, And the further findings after they looked at the tissue is that my mass, which she originally thought was 8 centimeters, and I had it measured in the office of my gynecologist, she said 7. And then later on I heard my breast cancer surgeon's nurse say 6. Well, it actually turned out to be 4.8 centimeters. And all of these doctors claim that that type of cancer that I have, which is estrogen and progesterone positive, HER, I think, negative. Anyway, they said that kind never shrinks, and mine shrank. So the good thing of that is that because it was that size, 4.8, the stage of my breast cancer on the left side was officially 1B. And smaller numbers are better for breast cancer. On the right side, it still was stage 0, but only in one place. There weren't actually 2. But because 2 of the nodes had cancer, they are telling me that they want me to have radiation on my left side. And yes, there could be a number of side effects, including it looks like I got a sunburn, and it could be painful. And since it's on the left side, it could affect my heart. So I am the most concerned about the fact that it could affect my heart. There are things that they do to take an extra precaution with how you breathe to protect the heart, but that's really the only thing they informed me that they could do. And they said that actually the area that they would be radiating would be around my breast and on the lower part of my neck, kind of that whole area, from here to here and around. So I'm actually still thinking about it, but I have signed up, but I can't take the radiation until I can lift my arms above my head, and I still have my drains in. I've had the drains for a whole month. They are painful, uncomfortable, and they get in the way of everything. So I'm having those taken out on Wednesday. So I will hopefully be feeling a lot better. Let me see, what else should I tell you? Well, I have already been to my plastic surgeon's office twice, and I've had the tissue expanders filled twice. So now I'm up to 240 cc. I believe that's how they're measuring it. The last fill was a little bit uncomfortable, maybe painful, and it's kind of been like that all week. Uncomfortable and painful. Plus, on top of that, I can't really tell if that is the correct size that I would want to be, because the drains are so uncomfortable. I have trouble trying any clothes on. So when I go on Wednesday, he's supposed to fill them again. So everything just looks completely different from the old me. So I have to make some sort of a good guess as to how much should go in. And when I eventually get to the final surgery, the implant surgery, the shape of the implants is not going to be the shape of the tissue expanders, I think. I think the shape is going to be more natural. So I just kind of have to imagine, what is that going to be like compared to what it is right now? I don't know. It's hard to imagine. I'm thinking in my mind that probably 300 cc on each side is going to be the most I would want to go. And then hopefully it won't be too painful this time. So if I do end up taking the radiation, it will be 5.5 weeks of treatments, the same time every day, Monday through Friday, 5.5 weeks. It's an insurance policy. So I'm thinking I'll probably likely do it, but I would like a second opinion. But I do want to be around for the rest of my lifespan, and I want to get past this so I can move on. I will at some point give a progress report so you know what's going on, but yeah. It is what it is. But I'm real thankful to still be here. You have a wonderful day. Bye.